My name is Paul Packman. I'm from St. Louis, and I'm a psychiatrist in clinical practice full-time, seeing general adult psychiatry patients. I did my training at Washington University undergraduate school and medical school in St. Louis, and after many years serving in the military and being a postdoc, ended up doing my psychiatry training at Washington University School of Medicine. At that time, Washington University School of Medicine's psychiatry department was the pioneering department in the terms of developing a medical model for psychiatric illness. At that time, we were in the minority. And then when one of our faculty members, Dr. George Winokur, who was one of the three being Dr. Eli Robbins, who subsequently was head of the department, Dr. Sam Guzay, who became head of the department, and Dr. George Winokur, who left to become the head of the Department of Psychiatry at the University of Iowa. When he left, we thought, or rather he thought, with some of the older residents and faculty members, that there ought to be a way for the mission and message of modern medical psychiatry could be spread. And so in 1975, the American Academy of Clinical Psychiatrists was created as a formal entity with a tax ID number and incorporated in all the things that need to be done. It started off as a relatively small group of Washington University trainees or faculty members who moved, and then it began to expand. In those days, there weren't many women in medicine, but it began to expand to include women trainees. And then as our clinical teaching and the niche that we filled got bigger and better, it now includes members from all over the US. We have now included nurse practitioners and other affiliated healthcare providers, and we don't identify ourselves as Washington University's baby project, but really we are a national organization. And this organization does something unique. We have modest-sized meetings, so not thousands, but hundreds. And all of our meetings over the years have in fact been devoted to practical clinical psychiatric treatment and problems. Whether the subject of the lectures may have been earlier on, psychopharmacology or various disease states. One title for one of our lectures was The Ups and Downs of Bipolar Disorder, where all aspects of the illness were discussed. We now have expanded it to a broader sense, which includes psychiatric update. And the psychiatric update is really important. During my tenure with the American Academy on their board, and then I took a 5-year hiatus, and now I'm back on the board beginning this year, I served as the editor of Psychiatric Update, which was a tape program. We did that for a couple of years. I've served currently on the board of the journal, the Annals of Clinical Psychiatry, as one of the editorial reviewers. I was the treasurer of the organization. I served 1 year as the president of the AACP. And so I'm in the old fogey class of an organization that is just continuing to grow and is very exciting. It's the kind of thing where the meetings are small, you meet people, you develop friendships, you develop professional relationships. We communicate with each other, sometimes describing a clinical problem. Have you seen a patient with X? What the heck do you do with that? And so on. So there's a lot of personal friendship and intimacy. There's a lot of professional intimacy and friendship, and it is an organization which provides practical clinical learning.